good morning or afternoon, wherever you are. Thanks for coming out for the first one of these med student focused case presentations. And I really look forward to getting a chance to talk with you today and share a couple cases that I got a chance to see when I was a med student myself. So let me see if I can share the slides here. So yeah, long ago, when I was in medical school, way back when, there was an occupational environmental medicine residency program at Emory where I was a med student. And I was so fortunate that Dr. Howard Frumpkin came and talked with us and shared some cases that were interesting to him and got me excited to apply for a scholarship they had to do an MPH between third and fourth years of medical school. And during that time, I was able to basically act like one of the residents. I did the MPH courses, and then I spent Fridays as the academic day with the residents. They had a journal club in the morning and a poison center conference with the Georgia Poison Center. And then in the afternoon, there was a consultative clinic that we all saw at the Emory Clinic. And they pulled in cases from all over the southeastern US that were referred, and they were pre-screened to make sure they were kind of interesting type cases. But that was what we did. Each of us saw one case over the course of the whole afternoon and had a week to put together our thoughts and write up a report. So I was able to find my notes on these cases from way back when, and I thought that, well, maybe if these were interesting to me and got me interested, maybe you guys might find them interesting as well. So you may see some drug names that look a little bit outdated since they're from about 30 years ago, but we'll see. So one thing that I noticed, and please feel free at any point ask questions. So causation, did whatever this person was exposed to or potentially exposed to lead to whatever their health condition is? And so at the time I did this article did not exist, but I think having a framework for how you think about that is one thing that is important within our specialty. So one way to think about it is to think about the framework that you see here, and we'll refer back to this. So as we're going through this case, think about, is there really evidence of a disease? What disease? How certain? Is there a good case definition? How sure are you of what's really going on kind of clinically, diagnosis-wise? The next part is epidemiology, or really the toxicology aspect, right? How strong is the association between the diagnosis and what the person was potentially exposed to? So, and that can vary. There may be, only animal evidence. There may be, human evidence. So that varies. Then you want to think about the actual person's exposure. So this gets to specific causation. The toxicology, epidemiology part is more general causation, but these cases are really applying that to a specific individual. So was this person exposed enough in a way that would be consistent to the diagnosis at hand? The fourth part is really, are there other potential reasons for this? So is this the only thing that could have caused it? Are there other things? Most often it's not any one thing that causes something anyway, right? So considering that is a part of it. And then last is, there are always other motivating factors or secondary contexts that might be going on. So how reliable and credible or potentially biased are some of the thoughts that you're getting? So you really have to take all of these parts into consideration and synthesize those into what your conclusions are when you're looking at a causation case. So the first case we have, I called it "Is It the Water?" And I thought this was really an interesting case. So this was a 49-year-old lady from Albany, Georgia, down south of Atlanta, and she was referred by her gastroenterologist because she had elevated liver enzymes and fatty liver on her liver biopsy, which at first glance, that's not really, an uncommon diagnosis at all. But let's kind of go through why her gastroenterologist sent her to us. She had been fine up until about 16 months before we saw her. And she said that before she got sick, just a little bit before, she started a new fad diet. She had put on weight and she wanted to lose weight. And she started drinking large amounts of water every day, about almost 4 liters of water a day. So quite a lot. And after about 6 weeks of this diet, she said that she noticed a chemical taste in her mouth and a sensation of thick, foamy saliva. And she said, "Oh, it tastes like there's peroxide." A couple weeks after that, she developed pain by her left ear with tender, swollen up lymph nodes on the left side of her neck. And they treated her empirically at that point. They first gave her amoxicillin. She still had ear pain. Then they switched her to levofloxacin and then gave her augmentin. So at that point, she still wasn't feeling better, and more of a serious clinical evaluation started. So she had a workup for infectious disease etiologies. She had a negative HIV and toxoplasmosis testing. She had positive results for cytomegalovirus consistent with a recent infection. So both IgG and IgM were positive. Um, she also had positive IgG for Epstein-Barr virus, so consistent with a prior exposure only and not an acute infection. She had a normal blood count. She did have mildly elevated liver enzymes, AST and ALT, as well as ALP phos. They did a CT of her head and neck with no acute findings and a negative bone scan. And they just said, well, she has a lymphadenitis of unknown etiology in her left neck. Of course, that she still started feeling worse and developed nausea, bloating, and diarrhea that was occasionally bloody, and ended up being found to be C. diff positive after all of her antibiotics that she got for her left ear pain, and they treated that. But she still felt bad over the next 10 months with nausea and diarrhea, chills, fever, night sweats, and still that ear pain. So 10 months after she initially started feeling bad, a landfill development was proposed near her home. And she went to the Georgia Environmental Protection Department to ask about testing her well water because she didn't want that landfill. She didn't want her water to be contaminated. She never did have her well water tested, but when she talked to the Environmental Protection Department, they told her that, well, actually, several of your neighbors have contaminated well water, and there's a military base and a tire manufacturing plant, both near your home, that have released volatile organic compounds. So at this point, she immediately switched over to bottled water. In addition to her diet that included a lot of water consumption, she also had a habit of taking nightly 30-minute hot baths. So she also switched to shorter showers from that. And lo and behold, her symptoms, she said, all resolved except for her ear pain. And her liver enzymes, though, stayed somewhat elevated. She went to her gastroenterologist, who did a liver biopsy, said that she likely had non-alcoholic steatohepatitis, NASH, because she'd had a weight gain. And But he said, you know what, this story is interesting enough and there's enough going on here that maybe you should go and get seen. So that's when she came to us at Emory. The rest of her past medical history, she had, putting it all together, she did have that CMV based on her recent labs. She had a remote history of cholecystectomy and a colonic adenoma and a hysterectomy. Only medication she took was Elavil, 10 milligrams at night, and she had several other allergies that you can see there. She had worked in real estate and sales, but had retired 10 years before. Her family history was not too remarkable. Her mother had passed away from multiple myeloma at 70, but her father was alive with hypertension and coronary artery disease and diabetes, but at age 80. She had four sisters in good health. And social history was significant that she consumed no alcohol. She was a half pack a day smoker and was married. Moving to her home, she had lived in it for 10 years. Um, and it was located 7,500 feet from the military base that had 24 areas that were known to be contaminated, and it had been designated as a Superfund site. There was one known release above reportable levels, and that was of trichloroethylene. And there were also multiple other chemical releases, but below reportable levels. She lived 2,500 feet from the tire manufacturing company with a reportable release of benzene, but other known releases, including trichloroethane and dichloroethane. So just a step back, because you probably wouldn't have heard of these, but maximum contaminant levels are the legally enforceable primary standards for protecting public health. And they're established based on the Safe Drinking Water Act. So they're set to as the level below which you hopefully don't have any health effects from long-term exposures. And it looks at both cancer and non-cancer effects. So if you stay below that, then there's no known or anticipated adverse effects. And it does allow for a margin of safety based on susceptibility of different populations. So those are relooked at every 6 years by the EPA. So when we looked at what had been sampled there in the area, there were actually 6 private wells that had been sampled by the EPA 5 years before this patient was seen. And they did detect trichloroethylene, TCE, as well as cis-1,2-dichloroethane, or DCE. The TCE was detected below the MCL, as you can see there, and the DCE was also below the MCL, and more significantly below the MCL. But 4 years ago, so a year after that sampling, there was a significant rain and flooding event in the Albany, Georgia area. So they went back and retested, because with a significant flooding event, you could have more contamination getting into the groundwater from these contamination sites. So TCE and DCE were again detected below the MCL, but this time methylene chloride was detected above the MCL. So the EPA at the time that we saw this patient were doing a study of the spread of contamination into the lower water bearing zone of this aquifer. And this was the zone for this patient's, the source for this patient's well. And their preliminary results were showing that there were contaminants that were going to be present above the MCL. So just a little bit for you on trichloroethylene. It's the most commonly reported organic contaminant in groundwater in the US. So up to 34% of US water sources are contaminated, but most of them are below the MCL. The MCL is based on potential adverse health effects, including liver effects, So, like was seen in this patient, or increased risk of cancer, especially kidney cancer. Acute exposure to trichloroethylene causes CNS symptoms, so kind of an intoxication type effect, headache, nausea, dizziness, clumsiness, drowsiness, kind of like being drunk. Chronically, there could be damage to the facial nerves, skin rash, and GI irritation. Um, so, thinking about this patient, ear pain, is it really the ear or is it coming from the facial nerve? GI irritation. Um, she didn't have any skin rash complaints. And heavy exposure could cause damage to the liver and kidneys. So, on physical exam of this patient, um, really there wasn't a lot. It was a pretty much normal exam. And then looking at her lab testing results, um, you know, uh, she changed up her what she was, um, and those labels are wrong. Sorry. On the left is when she changed her first change. Sorry, she made her first change to exposure to well water and started drinking a lot of it. And then the second arrow is when she went to bottled water. So you can see it kind of rose and then dropped, but it's a little hard to put too much together with that. So I'm going to pause for a second and give you guys a chance to talk. What do you think? What are your conclusions? What would you tell the gastroenterologist as you kind of think through this framework? How do you see this just based on some of what we've looked at here? Anybody?
I have a more general question.
Sure.
If she had used filters for like the water that she used, would that have helped maybe decrease the level of TCE, or does her like filtering water not matter at all?
Potentially, it depends on the filter and what's in there. So some chemicals can get filtered out and others not. I'd have to go back and look, but that is a good question to ask related to your environmental history that you're getting about her house and her sources of water. She didn't report any filtration there, and some of these chemicals don't get filtered out. And I got to tell you, I don't remember off the top of my head if this one was or wasn't. Um, but yeah, great question and a great thing to think about.
I was,
Anybody else? Thoughts, comments?
yeah, I was thinking it has to be something related to the water because she stated that she started to feel better after making those changes. So there's something to that, even though her labs didn't totally reflect, the data didn't totally reflect that.
Yeah, I mean, certainly her gastroenterologist was concerned enough to send her on to us, and clearly there could be, I think, something to it, right? So this is where it gets kind of challenging for us, and where you have to kind of think about this framework, and we also kind of think about it sometimes within that context of um, illegal and whatnot. So you want to only state what you can support with what you have. And these were kind of the conclusions that we came up with in the report for her. Um, so we said the groundwater contamination with VOCs did exist in her area, right? The problem was we didn't have exact levels for her well and exactly what chemicals might be in her well because they had changed over time, and you saw the long laundry list of potential chemicals. But we did think that the relationship between the symptoms that she had and TCE exposure were plausible. The GI irritation from a chronic exposure, the ear pain could have been related more to facial nerve, the all of what she was kind of seeing there. A few things didn't fit. though, that we'll get to. She was potentially exposed at pretty high, reasonably high levels. I mean, she was consuming way more than the normal person would for tap water. And she also had a potential for skin and inhaled exposures. Uh, with VOCs being volatile, the hot water tends to volatilize more. So hot showers, you can breathe more of it in, and you can have more get absorbed through the skin when you soak in it. So she really had kind of some potentially higher than normal exposures um, than most people would when they kind of put together those maximum contaminant levels. She'd be high on the exposure end compared to that. Like you mentioned, yeah, the temporality of when she was exposed, her symptoms, when she stopped her exposure and her symptoms got better, yeah, all those kind of made sense. The fatty liver aspect, though, really kind of didn't. That's usually only seen in really high chronic exposures to TCE. Um, so the other thoughts were, was it another contaminant like methylene chloride? Did it have to do with her prior CMV infection, or was it just NASH like the gastroenterologist had thought in the first place? So, um, you know, these were the things that we thought we could conclude and back up based on what information we had at the time. So I guess one thing I took away from that is it's environmental exposures can be very hard to kind of causally link to um, an exposure. And this one was interesting. The other recommendation there was to continue to track the liver tests to see if they continued to go down, because she had only stopped her exposure a few months before we saw her. So to kind of track that out a little more to get a little more information. So that was that case. Anybody have any questions or thoughts on that one?
And just a quick thing about the filtration, about the question regarding filtration.
Yeah.
Yes, there's a type of filtration that can remove TCE from drinking water, but it's not the filtration like home filtration for water, like this water dispensers, not that type. But granular activated carbon has been recommended by EPA for treatment of TCE contaminated drinking water. So they said that it can remove up to 99.9% of TCE levels in water. And so this type of filtration system called granular activated carbon or air stripping removes much of the TCE from drinking water. Another recommendation is to use reverse osmosis, which can remove up to 70 to 80% of TCE. So those are the types that can do it.
But very unlikely to be on a person's personal well. Those are more likely,
Yeah.
yeah, through a treatment facility, right?
Yeah, yeah, those are through water treatment facilities that can remove VOCs in areas that have been contaminated. It's one of the measures they use for remediation of water sources that are contaminated.
Great, thanks.
I have a question too.
Oh yeah.
So if these, like, I guess this contaminants are kind of leading the differential for this patient's condition, is there any like next steps that an occupational physician can do? Like, can they audit any exposures in like the water control company, or like coordinate with public health to kind of further explore what's causing it, or does it kind of end at the treatment of the patient?
Sometimes, yes. So definitely, if it's a larger water system, you can definitely go back and work with that. In this instance, it being a private well, it was a little bit harder. We suggested that she did follow through with testing of her own well water to see exactly what was there, and also recommended following her liver studies a little bit further. she was going to continue, limiting her exposure as she had been. And then, we were going to go from there. It's a little bit harder, if there's the contamination in the aquifer. Um, the EPA was already doing a study and working on that aspect. So there really wasn't much farther that we could go down that road. It was a known contamination problem. I guess there could be more communication though, because she, didn't know about it until the problems came up. So that's another area that could be explored is, having the Environmental Protection Division, maybe talking with them about how this is communicated to the community, so people could not go on, extreme water diets if there's a potential there. So, kind of a more general answer, but sometimes, yeah, if it was the water system, if it was if it served more people, you could address that too.
Thank you.
Sure. All right, so case number 2, I was going to call the moody maintainer. So this is a case that's more occupationally based. So this was a 44-year-old recently retired railroad employee, and he was referred by his attorney. And the issue of the complaint was mood changes and memory loss. So he said that his wife had first noticed some changes in his mood about 15 years before, so when he was around 30, and said that he had this had just been gradually progressing over time. He reported being depressed, had no interest in his activities that he used to like, kind of had irritability and labile mood, and then had been starting to develop problems with memory and concentration. So he first acknowledged that he had had issues about 2 years before when he was hospitalized after developing some suicidal intent. He retired 10 months ago and then says that things have been fine since he retired, or at least not fine, but not getting any worse. Just on review of his other past medical history, he had hypertension, gout, reflux, sleep apnea. He had been diagnosed with major depression after his hospitalization, carpal tunnel, and he had some seasonal allergies. But then we got into his occupational history, which is somewhat interesting. He had worked for 23 years for the railroad. In his first 6 years, he worked as a laborer, and his job was to clean locomotive generator compartments. So this is a picture of a locomotive, and one thing I learned is that locomotives can be kind of considered electric vehicles. So they don't have a transmission. They have a huge diesel engine, which converts to electrical energy through this giant generator that's in yellow in that picture that you see. So in that compartment, the floor of it would get nasty. And this person would take 5-gallon buckets of an electrical cleaner and pour it on the floor of that compartment. They didn't wear any PPE when they did this, and he described it as getting high as a kite, and that they had like a ramp that they went into that compartment on, and he would just weave down it and go out of the building a few times a day so he could get his senses back and then go back to work. So that was 6 years of that type of exposure. After that, he spent 4 years as a sheet metal apprentice, and his job there was to maintain the heating coils in vapor degreasing vats. So you can kind of see in the picture there, the heating coils are down on the bottom in red. They would kind of empty this giant vapor degreasing vat out, and he would go down into that part where the concentrated waste was and clean it out from off of those heating coils. And he said that about once a week he would develop symptoms of intoxication doing that job. And then for his last 13 years, up until he retired, he worked in the engine house. So when he did that job, his hands would get dirty and he would just use liquid solvent directly on his hands and tools to clean them about 20 times a day. He didn't use any PPE for that either. He didn't report any symptoms of intoxication while doing this, though. So his family history, his mom was with high blood pressure, but alive. His father at 73 was in good health, and a brother at 50 in good health. Social history was significant for alcohol consumption. He reported at 12 beers a week, denied any drug use. And his review of systems did show that generally he had a increase in appetite that he had noticed. Said he was even waking up at night to go and eat and had put on a fair amount of weight. He did have problems with hearing. Kind of interesting with all that solvent exposure and the potential for solvents to make noise-induced hearing loss worse. But he had some palpitations and sense of doom. He complained of some getting up at night, and you can see these other things here. His physical exam, though, really wasn't, he was, 320 pounds, but quite tall. He did have high blood pressure. His heart rate was rapid. Did not notice, though, anything too much until his neuro exam. He did have 24 out of 27 on his mini mental status, but everything else was within normal limits. So what do you think about this case? Do you want other information? What do you want to tell the attorney? What are you thinking?
I think I'd like more information. It seems that he's had symptoms kind of throughout his occupational history, and I'm wondering, did he go see a doctor then? Did he say anything to the company? And then did the company kind of take any actions based on what he said, or did he kind of keep that to himself throughout the whole time?
Yeah, he did not say that he had said anything else during the time, but yeah, good question. So you're getting down to that kind of validity of testimony aspect?
I I would like to see some imaging. I was just thinking about the comedones on his back and just the CNS um issues that he's having. I didn't think about like breathing issues or anything like that. And I think you said he was a smoker. So
Yep.
I'm kind of worried about some of the toxins that he's been ingesting since not wearing PPE, and maybe getting like a chest x-ray or something like that to see if there may be anything else going on that we should be concerned about.
Yeah, yeah. Uh, Imaging, definitely one thing. Any other testing that anybody would think about?
Yeah, I was thinking
And
possibly a drug screen just to rule out anything there.
Sure.
I wanted to ask which solvents, if we know which solvents he came into contact with in the engine house, especially since he didn't have symptoms, maybe he was actually having some chronic exposures that he wasn't even aware of.
Yeah, we didn't have the specific TCE. Was there again a super common solvent used for a lot of these types of purposes, but it's usually a mixture of different solvents. We did not have the complete listing of what was in there, because all of those jobs really, including when he was the laborer and pouring the cleaner into the compartment where he reported kind of daily, exposures to the point of feeling drunk, you know, that would have all been, he had pretty big solvent exposure, at least by what he was reporting.
I was also thinking of checking his like a blood panel to see if he has like a B12 or a folate deficient anemia due to, I think he said at one point he was drinking like 12 beers a week. I don't know if he was over or underestimating, but
Yep.
um going on there. And then maybe also checking like an amylase or something like that for his pancreas. See if he may have like and I don't know if he's expressing any abdominal pain or anything like that, but just to kind of cover our bases and see what may be going on here.
Yeah, he kind of complained of like a sour stomach for a couple weeks, but no big abdominal pain complaints. It was really more just memory, concentration, mood, lability, labile mood, and the mood kind of changes were his biggest complaints that he had. Um, so yeah, what I mean, yeah, what disease does he have? I think uh, one thing we came up with was we didn't really know for sure what disease he might have. So um, neuropsych testing, we thought might be something um, reasonable to get to try and figure out a little bit more too objectively how impaired he might be. The mini mental status exam isn't all that great for that, but try and get more information on any deficits that he had. He did have, though, like we said, based on what he described to us, some considerable exposure to solvents at work. But I agree that some objective sort of testing or measurements would have been super helpful for that. And there is always the possibility for it to be a you know um, biased kind of reporting. So objective evidence is always best. The temporality based on what he described of when his symptoms came on and having gotten at least stopped progressing once he retired would be consistent, but there was still a lot of differential diagnosis that we were worried about in terms of he could just have early onset dementia. It could be related to an alcohol related affective disorder, because so he may be underestimating how much he's drinking. The differential could probably be even bigger than that, but that was kind of generally where we went with it. So any questions or thoughts on that one, or both?
I was just thinking about how it's complicated when there is that workplace exposure. There is a limit to how much you can test, because you have to then go test the workplace
Yeah.
and retroactively in some cases because things can change. So it's kind of like it really sets occupational medicine apart from other specialties where you can always test the body directly.
Yeah, it's super different. And you think about this, like I showed my daughter these cases and she's like, "Oh my gosh, that exposure. Like they didn't use any PPE." I'm like, "Well, but this was before the OSHA Act." Right? So he had a 23-year career and I saw him in 93, so it was right at the very beginning of. So, yeah, the changes over time are really, interesting that way, I think. Yeah. Hopefully we don't see as much of anything this exposures that are that big, but yeah, we definitely the hearing and solvents and how that can be synergistic too is kind of interesting in this case to me. So it'd be interesting to have an audiogram and see if he had an initial one and all that. But any other questions?
Not really a question, but a comment just to support what you mentioned about testing. Because when exposures already happened, and by the way, my name is Ngozi Obi. I'm an occupational medicine physician. I'm just listening in. So you can also evaluate the workers, other workers that are working in the same kind of job, or people that worked at the same time. You can look back, kind of do some retrospective, investigation, or check people that worked at the same time with him, in order to establish causation, because you may want to look at people he worked with at the same time, if any of them is experiencing the same type of symptoms, even if they changed the workplace, made some changes, started providing PPEs at the time we were looking at these cases. But the, the period he worked, if there are people that worked and had the same kind of problems or experiencing the same kind of problems, having had similar type of exposures, you can also establish causation, or at least association between those exposures to the symptoms, some of the symptoms he's having. So I think that could also be done. Then the other thing I want to mention about his presentation is the carpal tunnel. So that could also be the type of neuropathy that he's experiencing from the
Yep.
solvent exposure. So that they could also do like a nerve conduction study to evaluate. So that's something else to also look into.
Yeah, awesome. Thank you. All right. Well, we do have a Kahoot. So there's 5 questions coming up here. If you're the winner, and go ahead and do them all as anonymous. But if you're the winner, screenshot your final result there and email it to me, and I'll send you your $50 Amazon gift card. And we have 4 of these sessions going. So whoever is the top scorer across all 4 sessions gets $1,000 toward attending AOHC in Chicago in April. So yeah, we're excited to do this, and let me hit the Kahoot thing and see if we can get that going. All right. Ready? Oh, and if anybody who's on here isn't a student and they're playing, don't win.
Is this pretty self-explanatory? I've never played it before.
Oh, you haven't? Yeah, yeah. It should be pretty straightforward. It'll a question will come up. It'll tell you either it's multi-select, so you can pick more than one answer, or a single answer, so there's only one right answer. That's probably the only part to know about it. You get points based on speed and accuracy, so you have to get it right to get points. But whoever gets it right first gets the most points.
I'm not playing. I'm just joining in to see how it works. I'm not
Okay.
playing.
Yeah, no, cool. I'm just making sure. All right, everybody ready? Let's go. In honor of the Olympics, I went with the Olympic background. Ten seconds to go. All right. So yeah, this was kind of from that causation framework that I showed you there. So all of those were the 5 parts of it. Input from the attorney was the one distractor there. So great. Any questions on that one? Maybe wasn't a well put together Kahoot. So let's see how the next one is. Oh, EC was first. All right, next up. All right. Yeah, it looks like most folks got it. So that's that maximum contaminant level that is set by the EPA based on the level that they think there won't be any adverse effects. The other things here, the threshold limit value is from the ACGIH. It's kind of probably the most continually updated kind of workplace standards. Permissible exposure limit is from OSHA. That's kind of your regulated legal limit for in the workplace. And then short-term exposure limit is not for all day. Well, on from there. Oh, let's see. Oh, a little shift around. Mitchell is moving up. All right. Any discussion on any of those first two? Or are you ready to move on? Hearing none, go into the next question. Most frequently reported organic contaminant in groundwater. All right, everybody got it. Let's see who was fastest. Oh, you see, still at the top. No, not too many changes on that one. We got two more. This one's a multi-select. All of the routes of exposure to VOCs in drinking water. All right. All right. Looking good. Let's see. Ooh, okay. It's close. Going into the final question here. Locomotives could be considered. All right. Probably a speed sort of question. All right. Here's the podium. Woo! Oh, all right. DC. Congratulations. Man. Screenshot and email me there, and I'll get you your gift card. And let me turn this off. And oh, you know what? I'm going to do one more thing. If you guys have any feedback on the session or the Kahoot or anything like that, please, feel free to give it now, and I'll collect it up afterwards so you can and put it in here. So that's what we had for you for today. Maybe I can turn my camera back on. Maybe it'll work. Anyway. And it's nice that I get to see you guys' faces, so that's great. Any questions, discussion, anything else before we sign off for today? Oh, and just in case you need my email again, it's kralpl@si.edu. And there you have it. Great. All right, everybody. Well, great seeing you. I hope you found this to be interesting and fun, and I hope we get and see you out the next 3 sessions here. So have a great rest of your weekend.
You too. Thank you.
Thank
you. Thank you very much. Thanks for
Yep. Bye-bye.